Hi everyone, welcome back to my channel. So today I want to discuss stem cells and ethical issues with stem cells. Now we all know the common concern about stem cells and embryos and abortion and all the sort of religious issues that go into that. That's, I think, the most common thing that people think about when it comes to stem cell therapy. But as I've been diving into stem cell therapy a little bit more. As some of you may know from my previous videos, I have been looking into stem cell therapy. I have not done it yet, but I have been researching it, doing consults, and I have started to see that there are more ethical issues with stem cell therapy than what we know. As far as I have seen from the clinics that I've consulted with, the whole embryonic stem cell thing is not, I don't think it's as common anymore. I don't think stem cells from embryos are being used as much. And I think one of the reasons for that is because they I think tend to be more dangerous as far as like becoming tumors or cancer cells or something. I don't quote me on that. I'm not an expert in stem cells or anything, but from what I'm seeing, embryonic stem cells are not commonly used by a lot of these clinics. And I don't think it's the the standard anymore. I think it was in the past, but it really isn't anymore. The stem cells that you're going to be seeing in a lot of these clinics, there's like a word for it. I think like autologous comes from like your own body or something, but I don't want to use any like technical terms. Some stem cells will come from your bone marrow or the patient's bone marrow. And so they have to do a bone marrow extraction and then, I don't know, do some kind of thing to it. And then they will reinfuse you with those stem cells. They also can take stem cells from your fat. And I think this is also not like the most recommended one because they're not like the best stem cells. I don't know. But they can kind of take some fat out and then I guess extract the stem cells from that and then reinfuse those into you. And I know that they do that. I believe they do that also for exosomes as well. But I don't really know the process behind that. And there is, I think, sort of what's becoming, I think, the gold standard, or it seems to be like the sort of the leader in these types of stem cells is cord cells. So basically from umbilical cord. So obviously you can sort of sidestep the ethical issue of embryonic stem cells by using cord stem cells and your own fat or your bone marrow. Obviously cord stem cells are the best ones, or at least that's kind of what I'm seeing, because they are brand new. They are fresh. As long as they're screened properly, those are new cells as opposed to your own old cells from your fat or your bone marrow or diseased cells. Because I mean, if you're sick and you're going to get stem cells, why would you want your own like diseased cells? So that, I think, sort of solves that ethical issue. And a lot of people may still think that when they get stem cells, it's like from an embryo or from like an aborted fetus. That's not happening. So just for those of you out there, you may always want to check. I do think that in some specific cases, they will use like a donated embryo or something like that. But I don't think that that's common anymore. And I think that's slowly being phased out because it's not the gold standard of stem cell therapy. But those aren't the main issues that I have encountered as I've done consults in these clinics. One of the, I want to say it's a disturbing trend. I know that there will be people that maybe are going to think very, very differently about this. But the one thing that I am seeing a lot with a lot of these stem cell clinics is that they are marketing to autistic patients and their families. So children, basically. I was not aware of this. I've worked with autistic kids. When I was still working, I worked a lot with autistic kids. And I was familiar with some of the interventions that the parents would, interventions or therapies that they would use for, to help ease some autism, some symptoms of autism. Diet is one. I think the gluten-free diet was really popular at one point for autism, like Candida, and like Candida-free diet or the low sugar diet, something like that. But I was not aware, and I had not heard of this. I mean, things may have changed. I haven't worked in probably almost a decade, but I'm seeing that stem cell therapy is huge for autism right now, and that seems to be the target demographic for stem cells, and like stem cell infusions and things like that. Two of the clinics that I did a consult with really market heavily, almost exclusively. One clinic, literally, it's like their specialty to treat autistic patients. And there, I think out here at Duke, I think it's Duke University or something, that they did some kind of I don't want to say that it's like a study or something, but with stem cells in autistic patients. But there's something going on with the study where the families actually had to pay for the stem cells. So the results are questionable. I was reading a little bit about it, that, because parents and, families still have to pay for this treatment for their child, how reliable could the study possibly be? Because obviously if you're paying for something, they're going to report the results as positive. Who's going to be paying for something, only to hear that it doesn't work? So, and that's also questionable as far as a study goes, because when it's a study, you don't pay for the treatment. The treatment is given to you as part of you being a study participant. So it's still questionable. I've read different things, but again, I think studies are inconclusive, or whatever data is out there doesn't really seem to show consistent positive results for autism and stem cell therapy. But that's like with stem cell therapy for anything. It's the same with Lyme disease. It's the same with multiple sclerosis. There's no consistent outcomes for that. The ethical thing, and I mean, some people are probably thinking like, well, what's the big deal? They do a stem cell infusion and, it's a kid. But I actually, I was watching I think I was listening to a podcast or something where a doctor was actually describing the process of it was actually one of the clinics that I had a consult with. For adults, if you go get stem cells, you're getting probably, cord cells, or sometimes maybe your own fat. But in this clinic that I did a consult with, if I went, I would just be getting an infusion of stem cells. I think cord stem cells or something. When it's a child, they use the child's stem cells. So they have to hospitalize a child, put the child under, extract marrow stem cells, and then, of course, go through the whole process of separating the cells, from the marrow, and then reinfusing the child. I mean, obviously, the whole hospitalization part is a little bit scary because, you're dealing with a child. This is an elective procedure. It's optional. It is not something that, I mean, like I said, I've worked with autistic kids. As far as I know, autism is not a life-threatening condition, but, I guess ultimately it's the parents. It's the parents that are making this decision and weighing the benefits versus the consequences. But for me, when I started, when I heard this description of the process, I was like, this is kind of, bordering on unethical. You're putting a child under for an elective procedure. They can't consent to it. It's their parents consenting to it, and then you have to infuse them with it. Obviously, it has to be an intravenous infusion, or sometimes they actually do intrathecal, which I think is like through the spinal fluid or something. I don't even know, but it doesn't sound pleasant to me at all. And if you've ever worked with someone that has autism, behavior can be an issue. I can only imagine what it's like to get a needle into a child that has autism or to put them out. I mean, it just, a lot of these things, because I've worked closely with children that have autism, it really sort of struck a little bit of a chord with me. And I was like, I don't know. I don't know how I feel about that. How I feel about some of the, especially because these clinics are marketing and heavily marketing towards these kids and their families, and also giving a person possibly a false hope that this thing, that this treatment may help them, may make their child normal, whatever that means. And I don't know, there's just something about that that really feels wrong on a certain level to me. So, it's questionable in my opinion. And that brings me to my next ethical point, capitalizing on the sick. And I'm pretty sure I touched on this in another video, but stem cell therapy is also marketed towards sick people, people with multiple sclerosis, people with Lyme disease, people with ALS, which we know is not a curable condition. Multiple sclerosis and ALS are not curable conditions. Lyme disease, as far as we know, has no cure. There's treatment, but there's no cure. Lupus, diabetes, and again, there aren't any real concrete studies to back this up. So to me, it's almost like, especially when it comes to ALS, I was actually really surprised to see that they are, pushing this for people with ALS, because ALS is essentially, what do you call it? Terminal illness. I've not heard of any treatment that slows or stops the progression of ALS, and these stem cell clinics claim that it could help ALS, which I think is pretty cruel. It's a little cruel to me that they would target that group of people. But as a whole, they do kind of, target people that have illnesses, people with strokes. And you're not talking about, a few $100s. You're talking about thousands, 20,000, more than $20,000. And, and there's no studies to really back it up. So these clinics are essentially telling you this can help without really having any evidence that it does. And, when I've been doing consults, and they're not going to tell you that it won't help you or that it can actually make you sick. I know that in some cases of Lyme disease, there are people that have an inflammatory reaction and they actually get worse after stem cell therapy. They're not going to tell you that unless you bring it up or unless you ask. I had one doctor at one clinic actually tell me that she has seen some patients with Lyme disease get worse from stem cells. At the other clinics, basically it was like, you're a candidate, here's the treatment protocol, here's the cost, this is what it includes, and there's really no discussion unless you bring it up. And I did do that with one of the clinics. I was like, hey, my doctor said this and this. Also too, the other thing that I brought up in another video is that you're not getting all of the stem cells that you think you are. They will promise you millions and millions of stem cells per infusion, but there is something called pulmonary entrapment. And my doctor actually told me that. She said 50% of these things, or 60%, go to the lungs and they get stuck there. She said, so you're not getting the amount of stem cells that you think you are. The clinics are not going to tell you that. And I do think that is sort of like unethical. That's almost like, like, I don't know, ordering something on Amazon, and you think it's like ordering one time I ordered a sunscreen or something and I thought it was full size, and I get it and it's just like a sample size, and it's like, that's kind of like what it's doing. They're kind of false advertising in a way. And they don't tell you that. And that is actually a phenomenon that is common with stem cells, pulmonary entrapment. They stick in your lungs and you don't get all the stem cells. They also don't reach your brain. So I didn't have any of these clinics tell me that until I went to my doctor and then went back to the stem cell clinics and followed up. And I was curious. I was like, what are they going to tell me? If I'm like, hey, my doctor said this. And when I did bring that up, then they were like, oh, yes, that does happen. But we don't necessarily agree with that. We think that it's closer to, maybe 40%. And yes, it's weird because it's not until you say something that they actually will let you know. And so I feel like those are, they capitalize on sick people. They capitalize on your ignorance, and they know that you're going in there with limited knowledge, because doctors here in the US are not going to recommend stem cell therapy. They will likely tell you not to do it because there is a risk of tumor development and other, really bad side effects. So they're going to tell you stay away from it. I have an integrative doctor that is, she's open to it. She's not really pushing me towards stem cells. She's pushing me to some types of regenerative therapies. Well, she's not pushing me. She's telling me about them and educating me on it. And, I'm fortunate that I have a knowledgeable doctor. But for the most part, people that go to Mexico or that go to other countries to get these therapies done, they're doing it because their doctors have no other options for them. And they're doing it sort of in spite of their doctors, not along with their doctors. And so that's, these clinics know that. These clinics know that patients are coming in, ignoring their doctors and saying, well, that's not helping me anymore. And I'm just, I'm taking my health into my own hands, and I'm coming out here to get this therapy. So they know that you don't really know what is actually happening when you receive these stem cells. And these clinics are not going to tell you unless you bring it up. In which case they might agree with you, or they might just kind of lead you into, different excuses, different, reasoning. So to me, that's, I'm not telling anybody not to do it. I'm not saying don't do stem cells or don't try regenerative therapies. I think these are just things to consider. There are some clinics, like there's one clinic that I'm considering right now that I don't see that they are heavily marketing towards an autistic audience or autistic families. They seem to be more into the sort of like health and wellness, anti-aging, that kind of thing. I respect that, because right now autistic kids and their families are the target. They're an easy target. And for a clinic to really kind of give up that whole demographic of business is it's a lot of money. It's a lot of money that they're letting go of. And so that really makes me trust them a little bit more. And at that same clinic was the doctor that actually told me. She said, listen, I am not 100% educated on some of your conditions, on one of my diagnoses. She said, so I really need to look into that more. She's the only doctor that said that. She's the only one that told me that. So most of these clinics are not going to be like, hey, look, we really need to think about this. They're going to be like, hey, here's your quote. This is what we're going to do. We're going to do all this stuff. You're going to get all these millions of stem cells, and they're going to make it, they're not going to like pressure you into it, but they're going to make it sound like they actually put some thought into it, when really they're just selling you, they're selling you the package deal that they sell to everybody else. So those are things to consider. Are you okay with that? Are you okay with going to a clinic that that treats children as well? Are you okay going to a clinic that has a specific amount of money that they need to make per year? These are businesses, right? These are businesses, and they're making money off of you and off of your desperation and your illness. And they have targets like any other business, like a Walmart, like a Nordstrom's. They have a target amount of money, a profit margin that they need to meet, and they have people working for them that are helping them to reach those profit margins. I've seen that in some of these clinics. They'll have like a chief financial officer, and that guy is in charge of helping them meet their goal of making 2 million or 5 million per year or something. So know that it is a business, and ask yourself if you're willing to contribute to that, because that's where your money is going. And also look at the people behind the business. And I've said this, I think, in two of my other videos. Who's behind these businesses? Oftentimes it is Americans that are running these businesses in another country. And who are they connected to? Are they connected to people that have been accused of fraud or other types of crimes here in the U.S.? There is one clinic that I consulted with, and I found out that some people that are sort of loosely connected with the clinic have a criminal record here in the U.S. So that can be an ethical problem, because if they're engaging in risky business practices or risky medical practices here in the U.S., what are they doing in another country? Even if the clinics are approved by the Mexican FDA or their equivalent of the FDA, doesn't mean that it's the same as the FDA here. Their policies may be a little bit looser, and I mean, you might want to familiarize yourself with that as well before you go to another country for treatment. So those are things that I've come across. The whole embryo thing does not seem to be the issue anymore. For me, it's these other issues of treating children that can't consent, and sort of capitalizing on people who are desperate for some kind of relief. And a lot of times the doctors do believe in these treatments. Sometimes they can also be a little bit blinded by the science, and it's only the higher ups, the owners of the clinics, the business people that really know what these treatments can and can't do. And the doctors are just sort of there, they're there making money. You also have to consider that the dollar in Mexico is, our money is worth so much more. And so $20,000 for a stem cell treatment will pay one employee's salary for the year, like the receptionist or something. So they need to live as well. So they're trying to survive, and you have to consider those things. They may not be considering the ethics behind what they're doing. And so that's up to us to really ask ourselves whether we agree with this, whether this is something that we feel is okay. Also your religion, I guess, if your religion prohibits this kind of stuff. But I don't know. I feel like these are sort of more personal, ethical things, ethical questions, not so much religious ones, but just, is this really a good thing to do? Is this a good way to make money? So that's what I've got for you guys today. This one was a really interesting one for me because, I'm the target. We are the targets for this kind of stuff. And we need to ask ourselves, we need to be smart targets, basically. We need to be intelligent about these decisions, and we need to ask questions. We need to really grill these people. I've been emailing one doctor back and forth, and I'm like, I'm not going to sit here and just let somebody tell me, let somebody sell this to me. I'm going to ask you questions. I almost kind of enjoy challenging him and saying, look, my doctor said this other thing, and sort of hearing his response back. So that you kind of have to do that in order to get accurate information. So I hope this helps any of you out there that are considering this therapy. It's still a long road. I still have a long road ahead. I'm not looking at, this is October of 2021. I'm not seeing myself doing this until probably next year. But we'll see. And, it takes a lot of thought, and I don't want to jump into anything because I know that there's a lot more to these types of therapies than what I know. So I hope this helps you guys. Leave comments down below if you think there are other ethical things related to stem cells and any other alternative therapies. Like and subscribe, and I will see you again very soon. Take care.